The SCHWIND laser has so many advanced features, all of them together, amalgamated, makes the SCHWIND laser, I would say, the ultimate machine in laser therapy for the eye.
I work with SCHWIND for maybe more than 20 years. I have more than 4 MRIs. The most important thing for me with SCHWIND is technology.
To perform a standard treatment, it's very easy. But to perform, treatments in a more difficult eyes and achieve a very good visual acuity and very good quality of vision, this is another story. Some of the customized treatments were a little bit unpredictable. And today, with the foresight, I think we can get the prediction much higher.
This tool is crucial, first of all, because you're able to see and teach to other doctors and yourself what you're going to do, but also if you plan to do something that maybe it is not what you want, you are able to change your mind before actually pressing the pedal.
Every eye surgeon knows what the shape of a good cornea after surgery looks like. A lot of these complicated eyes, they have already been treated before. The patients are a little bit anxious. So if you can show them, we do this to your eye, we'll come out with this result, and this result will almost 100% guarantee you a good result.
So the foresight is going to predict what that change is going to be in that eye, in that special eye, because this patient have a special thing like irregular corneas. I love it, and I do it for every irregular corneas.
Isn't it wonderful if you can do something, calculate what the eye should look like, treat the patient virtually, get the result you want, and then go to the patient and do it. This will make the stress of treating a patient with a complication much easier for the surgeon. And we all want to make everything easier.
Another thing that is a new add-on to the Atos is the CenTrax. The idea that when you dock the laser on the cornea, you're not just putting your optical zone where you're actually docking, but if the patient has slightly moved, you're able to modify and move the optical zone on the corneal visual axis to avoid problem to the patient like coma or halos.
The introduction of SmartSight NOVA, the CenTrax guided centration, increases also the quality of vision subjectively for patient, and we also measure the differences in wavefronts. So we have a smaller wavefront error, and automatically less aberrations increases the visual quality. When we talk about the energy, the customized energy settings also, it gives us a much faster visual rehabilitation, which for me, in my hands, is very comparable or same as femtolaser, which is a gold standard of how fast people see after the surgery. In the modern lenticular surgery, we have a combination of very fast visual rehabilitation, and we don't have a flap, which we have in femtolaser. So a combined surface treatment without a flap with a super fast visual rehabilitation. So this makes refractive surgery unique.
Now, there is no way that you're going to think to treat a patient without cyclotorsion compensation. We can treat any kind of methods that we want. For example, trans-PRK, that's going to be through the epithelium. We can do femtolaser, and now we can have lenticular procedures like the Atos that also we have.
A standard procedure for presbyopia for me in the past was a femtolaser. Let's start with monovision, which was way far back. Then I started to perform a Presbymax. So we have in Amaris, we have the software for Presbymax. In one go, we performed the flap, and right away we switched to Amaris. New feature, new thing, what I'm gonna do very soon is to perform one eye, the dominant eye, a treatment with lenticule for the distance vision as a SmartSight treatment, and for the presbyopic treatment I will use the Amaris. I'm always getting an excellent support from the very beginning of my, I would say, career with SCHWIND. Working with such a complex technology, it's not only important to have a good quality on a daily basis, but also to have a team which solves problems if they appear. So this makes for me SCHWIND special.